This is a second part of my video for home care Alzheimer patients. I go to show you this morning how I'm caring her on massage and physio part of it. I take her head on my hand when she's in this position, and I turn and give a bit of a massage on her neck, and bit of a movement, maintain a bit of a movement in her back, about a dozen times, and then comforting, giving a bit of a massage on through the head, neck, and the back, taking her hand in my care and giving a bit of a physio movements, maintaining the movements of the elbow and shoulder, the flexibility. They are pretty rigid already, so it's difficult to maintain the movements. But every day a little bit, so it keeps the moving parts somewhat flexible. And same in the muscles, bicep, tricep, forehand a little, and then wrist. What is already very rigid, so I try to maintain a little bit every morning, and it's noticeable once you get it going that she relaxes and rigidity not disappear, but comes a little bit easier to handle. I straighten her fingers and put her fingers around the bed rail, and she gives me a bit of a hand to holding herself in such a position. You can't roll her anymore into any other positions. You have to be on the side like that. She got not willpower herself on it, so she only maintains the hold like that when it's supported by her hand. I give a massage on her back every morning, same ritual. Give a little bit of a movement on the skin. As can be seen, her back is in perfect condition. I maintain, I use the reams and Sobolen reams on her skin, so there is no mark on it, no bed sores like such on most of the people who are in this kind of position, always on their back 24 hours a day, months and years after years. So it takes a lot of work to maintain a good skin condition. But in her case, her skin is perfect condition. There is no mark, anything, and it's a comfortable thing. I change her 8-hour intervals, so the bed is always dry. This is a morning bed. Just open it up after the night sleep, so everything is relatively dry, except for the pads, of course. Then I give a bit of a massage on her legs, a little bit of a movement on the toes, massage in there, flexing the knee, and then another foot, same thing again. Notice the heels and sole condition between the toes. There is no defects whatsoever. Everything is maintained very well. I use the reams on her heels. There is no hardening on the heels or skin. And same again, a little bit of a movement on the legs, light movements, and gives a bit of a feeling, the living feeling on her legs. And this is every morning ritual I maintain, and getting excellent results. The patients like that, when she can't do anything herself, she's 100% dependent on the carer. The home care is a very good solution, because you get the best there individually. Most of the nursing homes, there is no one-to-one basis for caring. But home care like this, it's always available for 24 hours a day, whatever is required, and it's there right away available. So it's easier to maintain the patient's condition, and she gets the best benefit, and long run it's easier for carers as well, that you don't have to working on for the defects and things what comes to it. That's about the best part of it for home caring. You can give the best for your patient, and she benefit just as well of it.